And then working with him, we do the same thing. Is when I work with him, I try to get closer to what happened? What led you? When did you start? Like, you're not always thinking that your wife is cheating. You're not always angry with her. So what happened now at this moment? And then, for instance, he'll start talking about how he has a job where he spends long periods of time alone. And that's when he starts thinking about his wife cheating on him. Hello, everyone. Welcome to the Narcissism Decoder. I'm your host, Dr. Anthony Mazzella. Today, I'm thrilled to bring you an interview I had with Lisa Taylor Austin. Lisa is a highly respected psychotherapist in private practice. Alongside her clinical work, she shares her insights on her video channel, where she educates and empowers a wider audience. What I'm about to play for you is part 2 of our discussion on some concepts that are really important to understand if you're dealing with narcissistic characteristics, either your own or perhaps someone who was close to you in your life. Our discussion was quite extensive, so I've divided it into 2 segments. What I'm about to play is the second part of our discussion, where Lisa and I move deeper into the therapeutic approaches used to treat NPD, focusing on specific techniques like containment, detoxification, and interpretation. Just to get you oriented, I'm about to play a segment of the interview where I was discussing how I work with what we were calling the projective, introjective, malignant cycle. I know that sounds like a mouthful, but don't worry, I'm breaking it down. If you have not yet listened to the last episode, I encourage you to go back and listen to it, because in that episode, we ended with me giving an example of how I help someone who is projecting their negative self-image onto others and onto me. Lisa was one step ahead of me, but let me just bring you right back into the interview. I hope you find it insightful and thought-provoking. Yes, and I would just add one thing. Safety is paramount. And trust, developing trust, but it's not enough, right?
Right.
It's a good way to start, but eventually what we have to do in a treatment that's going to be long lasting, in other words, lead to lasting change, is we need to begin to show them how frequently and how often or automatically they interpret things as if somebody always has malignant intent, right? Because that's the projection. So in psychodynamic psychotherapy, we're not dealing with helping them get along with somebody necessarily, although that would be the outcome, because as you can begin to create some space, when trust develops and you help them begin to reflect on how everybody has this malignant intent, and they begin to see that this is not a new relationship. Because if you're with these people over some time, and then it repeats itself with you, right? Now this is really where it's the value of the work, is when this happens with you in the room and it comes alive. That's what we call the transference. And working in the transference in that way is really valuable, because now, you don't really ever know these other characters in their life. And maybe to some extent, these other people do have malignant intent. It's possible they do. But in general, I don't think I do. And if I do, I have to really slow down and reflect on that, by the way, if that's what I'm being accused of. But if I figure out that I don't have malignant intent, now we can begin to help them really sort of distinguish between the way that I'm actually behaving, right? Like the reality to this, and how they imagine I'm behaving. And then that, of course, would lead into how they are recreating what we call, again, just to borrow a little bit of jargon, an archaic fantasy object. And that goes back to our first conversation with those early introjects. Those are those caregivers who are either abusive or neglectful or inconsistent parenting. Remember, we spoke about that. So those are the archaic fantasy objects that get projected. So the first order of business is, after you develop trust, actually, I should say the second order, there is sort of a way you need to do this, because if you rush it and you interpret this stuff too early, they're not going to trust you. They'll just feel criticized and attacked if they don't have the space to take this kind of thing in. They'll just insist that you really are trying to, you really did end the session early, and they'll insist on that. Anyway, so that would be sort of the second step, is to help them become aware of the distinction between their archaic object and the real external person That's who you are, and that's who they're talking to right now. And when this goes well, this is one way in which psychodynamic psychotherapy is mutative, since it produces now a breach in that vicious, projective, introjective, malignant cycle that I described earlier.
Now they have a positive experience to add to their memory bank.
I think you're getting ahead. Not yet, okay?
Not yet. Okay.
We hope that they do, right? We hope that that's what eventually happens, Lisa. But at least now we hope they could question whether or not you are really a malignant person. And if you're someone that then they could begin to take in and really trust, right? So yeah, to your point, over time, for it to be a positive experience is really a developmental achievement. And that takes time, because then you have to be able to say, Dr. Mazzella or Lisa has enriched my life, or had a really good point, or I value something. And for the narcissist to say something like that, that's like groundbreaking. And it's really rewarding when you see it happen, even in little doses. If they say something like, I thought about something you said last session, and you're like, whoa, hold on a second. Can we go back to that? I may even stop them and say, what happened there? It's not very often that you think about these things. And how was that for you? What did it feel like to be we want to get closer to that and reward it, right? Because that's wonderful if they have that capacity. Because for them to say you rewarded or you've enriched my life, what they're admitting to, on another level is, I don't know everything, right? I'm not so omnipotent. I'm not God. I am not all-knowing. And of course, as you know, Lisa, in interviewing these people yourself, that's the structure that really holds them together. That's the grandiose sense of self, if that makes sense.
Yes. And the therapy process sounds like it's a long one, but there's a lot of undoing and re-experiencing, I guess, that the client needs to have.
Yes. Can I just say one more thing about that?
Of course.
Again, for your listeners, they may not be thinking this so much like therapeutically, but let's say they're in a relationship, and you may hear cases like this yourself, Lisa, where the woman comes in and she's complaining, like, for instance, her husband keeps accusing her of cheating, right? Then what I would do is I would talk to her about how she responds, right, when he's so convinced that she's unfaithful. So my work with her is around how she should not immediately argue with him. And don't tell him, you're crazy or you're out of your mind. I'm not cheating on you. You're projecting. Right? And believe it or not, this is things that people say, because they get on the defense. And that's, again, part of that cycle that we just went over. Because now the husband will take in, oh, I'm being accused of being out of my mind, or I'm crazy. I don't have a sense of reality. So with this woman, what I would do is I would work with her is to begin to, the same thing that I described that I do, right, is to get closer to his experience. Instead of fighting with him and arguing and claiming that you have, the truth. I know, and I'm not, take him serious and say, what makes you so convinced that I'm cheating? What did you see? What did you notice? Did you find something? See, slowly you help them then begin to recognize that in reality, there were really no signs that you're cheating. And there's no history. If this is it's a different story, of course, if there's a history of infidelity, that's a whole nother matter. But if there's no history of that, it's then what are you looking at here? What are you finding here? And then working with him, we do the same thing. Is when I work with him, I try to get closer to what happened? What led you? When did you start? You're not always thinking that your wife is cheating. You're not always angry with her. So what happened now at this moment? And then, for instance, he'll start talking about how he has a job where he spends long periods of time alone. And that's when he starts thinking about his wife cheating on him. And, you and I discussed this in the prior episode. We just alluded to it. But remember I said that's not thinking? Remember that whole thing? You mentioned obsessing about something?
Yes.
Yeah. So you see, now this is the whole the malignant cycle again, except it gets played out internally in him when he's alone. And then when he gets with her, it all gets projected onto her. So then I would work with him to understand that he creates this fantasy in his mind, and he's not really thinking about why is she cheating. And I want to know, why is she cheating? Why do you create that image of her? And then he starts talking about, Lisa, and this will be the last piece I say about it. He starts talking about how he doesn't feel like, because he has this job where he works long hours away from home, that he deserves her. And that unravels slowly into he doesn't feel worthy. So now you see, we're dealing with a part of him that was split off. Remember the splitting? And projected onto her. But now we help him own this piece of himself, that there's an unworthy, devalued piece of him. And this is how we begin that process of integration, which is so important when working with personality disordered patients, because the fragmented sense of self and the splitting that we discussed earlier.
That real life example is so helpful. Thank you for adding that.
Yeah, of course.
Because I think that that's something that many people experience if they're in a relationship with someone with NPD, either as an intimate partner or, a sibling. It wouldn't be about cheating, but, maybe they'd be accused of something else.
Oh, yes.
So that's extremely helpful. Thank you so much.
Oh, good.
I want to get your thoughts on this. There's a therapy out there. It's not existent in the United States, but I think people who listen to social media may have heard about this.
Okay.
There's a therapy out there that recommends re-traumatizing a person who has narcissistic personality disorder.
Interesting. That's very interesting.
To then be able to properly take care of that person in the therapeutic setting, so that person can create a healthy bond and create a healthy self-identity. I have thoughts about that. I'm curious what your thoughts about that are.
I'm a little surprised right now, to be honest with you. Can you I have some immediate thoughts, but tell me just quickly, if you don't mind, can you kick that off? Like, what's your knee-jerk reaction? Like, what are some of your thoughts about it?
Well, I do EMDR. I'm an EMDR therapist, so I work with people who have had trauma. And although all people with trauma don't develop NPD, right?
Yep.
Many people with NPD have trauma.
Mm-hmm.
And the thought of re-traumatizing a person seems cruel.
Yeah.
And at best.
Yes.
So that's my reaction to it. But I'm thinking you probably have a more clinical, psychoanalytic response than I do.
Okay. I mean, I could try. My first reaction, and then I'll go into the clinical piece a little bit more, was this way of thinking about it is incredibly superficial. Like, someone who believes this, like this re-traumatizing someone, does not have the capacity to understand how traumatized these patients are already, but that they're living with this trauma every day. So I guess according to that theory, the argument would be what? We re-traumatize them because we don't see the trauma, right? Because the narcissist has this grandiose structure. That's what I'm imagining. Is that right, Lisa? Maybe they have this grandiosity and you can never get to this depth maybe, or this other levels unless we re-traumatize them. Is that fair for me to say? I'm imagining that's the theory behind it.
I think so, yes.
Yeah, so what they don't take then into consideration, and again, based on what I, just off the cuff, is a very superficial understanding of narcissism, is that with these individuals, the trauma is alive every day, but it's hidden, right? So in other words, there's internal suffering that is, in the grandiose sense of self, they have this dismissive attitude. So you don't see the suffering. But anybody who lives life with this grandiose sense of self, this omnipotence, I actually did a podcast on this, how difficult it is to live life in this omnipotent state of mind. It's not easy. On the surface, people may think, oh, they're the life of the party. They're so fantastic. They're always just boosting their ego. But there's an incredible amount of anxiety that comes along with this. One, just because, let's just say, for example, they don't know when it's going to stop. Like, because they know that this flips. Again, that's the fragmented sense of self. They know that vulnerable, that covert narcissism, that's just another, that's there too. And it's only a matter of time that they'll be slighted. There'll be a narcissistic slight, and this will flip. So even in the grandiose state of mind, when I talk to these individuals, because remember, I said I get very close to this, they are still very anxious and they are very vigilant. There's like a hypersensitivity. There's an insecurity. They're always worried about what? Feeling shamed or humiliated. That is always there. So you don't need to re-traumatize them, because in the grandiosity, there is already that trauma. That's the whole point of the grandiosity.
Right. Re-traumatizing people who are already traumatized just is incredibly wrong. And what I heard you say earlier in this conversation today is that you come into your sessions with people with NPD looking at their life and the life they experienced through the lens of their eyes. Yep. There isn't a need to re-traumatize a person.
You could appreciate that the life that they're living, even if it's in the grandiose state at that moment, is still trauma. It's there. But you just have to get close enough to it and be patient.
Right.
Right. And slowly not re-traumatize them and rush it. So that's the other thing I would say. They have a superficial understanding of narcissism and maybe a lack of impulse control or a lack of patience, that they can't appreciate that these things take time. Structures develop in the mind of narcissists that take a long time, as you mentioned a couple moments ago, to unravel and really make sense out of.
Yes. Can you share with us a little bit about TFP therapy for narcissistic personality disorder?
Yeah, so just so you know, TFP, I think I can't even remember. Everything is blurring a little bit. I don't know if I mentioned it in the first interview that you and I had or just today, but TFP is everything that, when you came in, Lisa, with this idea about introjects, and we're talking about projection and introjection, we're talking about splitting, this is all TFP. This is all the theory, the underlying theory. TFP is transference-focused psychotherapy, and this is what they believe in. This is their theory, that there are these dyads in life, that we relate to people based on internal representations, in part, so that we create fantasy relationships, and then through the transference, that's why it's called transference, it gets played out in the room, and then we help them separate out what's real and what's imagined. And I'm not an expert, just so you know, and I want to just make that clear. I have studied, taken courses, I should say, seminars with Kernberg and Yeomans and Caligor and Diamond, like all the people who, I've been to their seminars and I've read their books, but I've never taken they have a formal like 1-year course. I've never taken that. But from what I understand and sitting and reading, their content, it's pretty much what you and I have been talking about already. That there are these internal representations that get played out in the transference. And then that's where we have an opportunity to help them develop a more fragmented sense of self through integration, as I was demonstrating in those examples I gave earlier.
So it sounds like there are at least two, very helpful therapies for people who have narcissistic personality disorder. One is based on a psychoanalytic theory and perhaps psychodynamic, and the other one is TFP.
Well, okay, so it's a little confusing. So TFP, it is a psychoanalytic theory. It's not psychoanalysis. And one of the main things that I would say distinguishes between the two is it uses all the same things we do in psychoanalysis, but the frequency is less. I think that's one of the main distinguishing characteristics. In TFP, they ask patients to come in twice a week. When one is doing psychoanalysis proper, at least the kind that I practice and that I've learned, typically patients come in 3, 4, 5 times a week. So it's just a more intensive experience. But TFP is based on a psychoanalytic model. All the concepts that I've been using, and you've been using too, Lisa, right? Introject, splitting, all that stuff derives from psychoanalytic theory. That's where it comes from.
Thank you for that correction. I would really love to continue talking with you about different aspects of NPD, because I'm finding that the way that you explain things makes sense. It just makes sense. And I think to people who don't have any training at all in mental health, it can be incredibly helpful for them to hear. It's really important, I think, especially with social media nowadays. Many things are sensationalized, and one of those is NPD. And people are listening to social media personalities who don't have any training or experience or knowledge at all in NPD. So I think it's really important that people listen to those in the mental health field to hear accurate information. So I appreciate that so very much to be able to talk with you today, to have that experience.
Thank you to you too, Lisa. I said this the first time, but it's worth reiterating. Thank you to you because you're out there, a professional, putting out good quality content, using concepts and really trying to understand all of what they mean and how important they are to really understanding sort of the underlying dynamics of this really complicated personality disorder. So thank you.
It's very complicated.
Yeah.
Yeah. So you do telehealth or online counseling in New York and in Florida. Mm-hmm. Correct?
Yes.
So people can find you through the Narcissistic Decoder or also through your website. And what is your website?
The podcast, I didn't want to make a big deal about it earlier because it's not a big deal, but it's the Narcissism Decoder. But you'll have it, I'm sure, in your notes anyway, so it's fine. And hopefully you could put the website there too, but it's just drmazzella.com. It's just my last name. And if anyone goes to the website, they'll see there's so much content there. There are videos, there's the podcast. I write an article every week and I post up new material on all the different facets of narcissism. Because Lisa, I'm sure you can imagine, right? There's so much to say because of it's so complicated. So there could be a never ending stream of this. And actually, speaking of stream, that's our next project together. So for anyone who's listening, that's what Lisa and I are going to do next. We're thinking about doing a live stream and having everybody come in and just ask. Lisa's asking her questions, which are wonderful. But right, Lisa, we want to get other questions as well to really open this up.
Absolutely. I think it's really important that people have an opportunity to ask you directly.
Us, Lisa.
I look forward to that. Thank you again. So much, yes. Dr. Mazzella. And I look forward to talking with you again.
It was my pleasure. Thanks, Lisa. Bye for now.
Bye-bye.
Disclaimer alert. The Narcissism Decoder podcast is provided for general information purposes only. The content presented in this podcast is not intended to diagnose, treat, or cure any psychological condition related to narcissism. The content on this podcast should not be considered a substitute for professional medical advice, diagnosis, or treatment. For specific advice pertaining to narcissism or any other psychological condition, you could reach me directly. I am an experienced mental health practitioner who is always taking on new patients. If you would just like a consultation, I can do that too.